Hey everyone, welcome to the show. So you want to become, and I'm your host Krishna Ranganathan. Today we have with us an ophthalmologist who has over 2 decades of experience, and also the person who did the cataract surgery for my dad, Dr. P. R. Mitra. Personally, I wanted to know the science behind what happens in the eye and how does one tackle those. But also, we like to see that I wanted to know about the emotional mindset that a surgeon must have before going into the surgery and etc. Sir, welcome to the show. Thank you for being here. Thank you for taking the time out of your schedule to be here.
Oh, it's a pleasure. I know your dad for a long time, and he's been, a good patient, if I might put it that way.
So, you have seen the medical system evolve in the decades. So, how was your definition of what the doctor you wanted to become has, and how has it changed over the years?
It started off, as I said, I wanted to become an engineer. That was not to happen, and I became a doctor. And after you finish medicine, I was at a quandary. It's very much like, where like how you are now planning, letting us people know what branches to take or what profession they should choose, what course or what line they should, study. So when we finish medicine also, some people are very focused. They know exactly what they want to do. And there are people like us who, aim for the sky and we usually land badly on the floor. So yes, finished medicine. There was thought of becoming a neurosurgeon. Didn't happen. My dad is a general surgeon, so thought about general surgery. And God's plan, I became an ophthalmologist, where I realized two things. One, you can still operate. You still go to the theater, which is a passion for me. I like to do surgeries. And the biggest thing about ophthalmology in a private practice is there is no night duties. So there's no night calls. So despite being in a profession and as a doctor, you might have heard friends, neighbors, relations being called in the middle of the night, 2 a.m., come to the hospital and all that. In ophthalmology, especially private practice, it doesn't really happen. So I got the best of both worlds. I get to work during the day and sleep well at the night in the night.
So, from when you started off as an ophthalmologist, how has the technology since evolved?
Tech was, it depends on where we were at what point of time. When we started off, Arvind Hospital was doing massive number of surgeries. So we were one of the first set of postgraduates among ophthalmology centers across India where we got to do a lot of surgeries. So even if you're an all thumbs person, at the end of your course, you can do a decent surgery. So that was the foundation. And when you become a good surgeon, you can adapt to newer tech, newer methodologies, newer equipment, newer strategies much easily compared to someone who's still struggling in the first phase. So for us, it was like just duck taking into water. So anything which came in new, couple of cases to get the hang of what we should do, and we were in it.
Were you able to get used to it like that, or were there any difficulties faced?
It's all in the mind. If God's gift, if you come with a good skill set, you just have to play your cards right. So you should not abuse your skill set by promoting yourself like you're the only one. You should always believe there are better people, better surgeons than you. And at the same time, if there is a surgeon whom you feel is not doing as well as you, it is our duty to sort of help them also to reach a good plane. They should not be like, put down and we look up only to the guys who are doing really well. We should maintain a semblance and a balance.
There are reports, and they say by the year 2030, AI will be more, prominent in the medical industry. So, for a person who wants to pursue becoming a doctor, what is the one skill that he or she must pick up?
The treatment skill. The AI can diagnose, but the AI can't treat. Or it can at least tell you what to do, but finally a human being who is qualified should carry out the treatment. That AI can't.
And it'll take time for them to realize it, or is it how do they actually get to the part where, well, the touch and feel, how do they understand it? So a doctor must touch and feel to realize what is the problem. I think that's
See, now already they have started bringing in these mannequins instead of the real thing. But believe it or not, if you are put in a real life case scenario, you are, for example, attending to a trauma victim, there all this AI touch skill and all goes through the window. It is what you have learned by performing, what you have learned by what your seniors have showed you to do or your professors told you to do. It has to come down parampara. AI can't help.
it'll take a lot of time for them to learn.
You're walking down
Mm.
a pathway, a lot of people are walking, and someone has a heart attack. How will AI help you? You have to give CPR. You have to give mouth to mouth. Nowadays you don't, but you have to give the chest compressions. But AI can't help you there.
Maximum it can do is call an ambulance.
Yeah, but by then in Indian traffic, more vehicle, the ambulance travel.
As you prepare for your upcoming surgery, what are the things that go through in your mind, and how do you keep that calm and composure?
One, I pray before I start each case. Two, I get into a zone. So even if there's an earthquake outside, it doesn't rattle me. So for that 15 minutes to 20 minutes of surgical time, nothing rattles me. So you've sort of got into that zone. And it's just 15-20 minutes. I'm not doing a, neurosurgery where I'm doing 6 hours or 8 hours. I'm just doing 15-20 minutes. But it is high intense. We're using all our faculties. Eyes, ears, except mouth, we don't talk. Eyes, ears, hands and feet. All are put to test at the same time. So yeah.
It's not just mere hand-eye coordinations.
And we have to use our feet also because the feet control the probe which is in our hand.
Okay, so what does the probe actually do then?
The probe MLC, see, the probe has multiple functions. So it's like the accelerator of your car. Okay, you can choose to drive inside the city. You drive differently when you're on the highway. You drive differently if you're on a bad road. So you have to titrate your feet to use that thing because the hand is only pointing the device to a part of the eye. But what the probe does is controlled by your foot.
So I'm pretty sure as you grew as a doctor, there must have been a time where you wanted to change your approach. So if you ever had changed your approach, how was the impact?
I, honestly speaking, didn't change my approach. Love my patients, talk to them well. If you see my clinic, you'll find we see very few patients in a day. That allows me to give quality time to each person, which is very important. I feel treatment is just part of the whole thing, but empathy and showing concern and helping them, get back to normal, I guess, is something which should be in all branches of medicine, including ophthalmology. So I have been like that from day one. It's helped, and it's helped my practice grow as well.
So empathy is actually a major factor when you, like, for example, a patient comes to you with cataract, and then they have the fear of losing their vision. So I think that's also a factor where
You
how do you
have to
conduct
you
it?
have to talk to them and explain to them what are the pros and cons of things, but keep the side effects or what can go wrong to a minimum. Because if you're going to tell them all the things which can go wrong, they will never step into your theater. And in cataract, touch wood, uh, very rarely do things go wrong. It's it's the most common surgical procedure in the world. And in good hands, things going wrong is, you could be struck by lightning twice rather than have a cataract complication.
What are some of the common misconceptions that people have about surgery? Meaning eye surgery, of course.
They get more information both before and after surgery from their friends and relations who are the worst possible people to get information from. They tell them all the things which, hearsay. They've never experienced it, but hearsay. Somebody has told them that you need to sit in a dark room for 30 days. So all those, you shouldn't have head bath for 30 days. It is the most ridiculous thing I can ever think of. Just imagine not putting water on your head for a day, and just imagine you go crazy. And these people are sitting there for 30 days despite knowing that the doctor has told them ki have a bath. So if they follow the doctor's advice to the T, I think their outcome, not the surgical outcome guaranteed by the doctor, but physical well-being, and that outcome will be much, much better. They will be more happier people if they do things which they've been asked to do.
So just listen to the doctors as and when they say it.
Yeah,
To the T.
exactly. There are advances. See, most often there are people who give an injection to numb the eye before operating. We do not. So what happens is you are able to open your eye and blink and be normal right from the time you step out of the theater. So there is really no need to close your eyes and sit in a dark room, because you're able to blink and close and open your eye. So there's no pain, because we are not put a 1-inch needle into the socket, and recovery is faster. So when we have made such advances in, these are not new advances, they have been there for 2-3 decades. We are able to make the patient recover much faster. So why doesn't the patient, not him or herself, feel to recover faster on their own?
In your view, well, what do you think distinguishes a good doctor from an exceptionally good surgeon?
I'm not growing as a doctor. I see the same number of patients that I used to see before, but I have embraced new tech. I have embraced newer procedures. I have embraced all of them, and I'm applying them on my patients. I'm not saying that the results are way different from what it used to be, but I'm able to make the patient more comfortable and recover faster because of the newer tech.
And I think eye is a very delicate component of a human body. It's a very it's a very unique entity from where it processes through our brain to the eye, what it sees. I mean, you know it better than I do. So as a patient coming to you talking about my eye and going through a surgery, it will put me in a lot of fear. So how do you explain it to the patient that it's all going to be fine?
Partly, I've seen most of my patients come counsel because they have been brought by a friend or a relation who's already had a surgery. So most of their counseling is already done at home or with friends who tell them, come, don't worry, I'm taking you to a good doctor and he's really good. That helps a lot. So we still have patients who are apprehensive, and it works this way. Like, we have overconfident patients who say, we'll be fine, don't worry, we'll listen to everything that you tell us, and on the table they'll throw a tantrum. And we have the other way around, where people throw tantrum in the office, but when you put them down on the table, they're absolutely gem. Like, they'll listen to every little nuance that you tell them, to every instruction they follow. So yeah, being in this profession for so many years, we've seen every possible scenario which can occur, and experience helps us keep ourselves level-headed and go through the process. And it's only 15-20 minutes, so no big deal.
In your view, what do you think distinguishes a good doctor from an exceptionally good surgeon?
You have to either be born with a good skill set, or you have to acquire one. Acquiring one is very difficult, but not impossible.
What are some of the possible research areas that you think can be explored upon or improved upon? And yeah,
Neural vision, which means using the occipital lobe to see rather than the eye.
what is the occipital lobe, and how can you
The
explain?
occipital lobe is the part of the brain which sees. It's in the back of our head. So there are many reasons when the eye cannot be used. And you can't just replace the eye like, replacing a car tire. There are a lot of parts which are irreplaceable. So if the whole neuronal pathway is lost from the eye to the brain, why not use different methodologies to make the part of the brain which is seeing is still functioning well, no? So why not use that part to see instead of the eye?
So the whole instrument of the eye is not functioning, but then you're able.
See, you can have severe trauma. You've had cancer of the eye where you lose the eye in once you replace the globe, nothing works. The globe means the whole eyeball, the whole unit. So if it's part of the eye which has to be this thing, then yeah, you can do some kind of salvage work. But whereas the whole eyeball is lost, you can't get sight in that eye at all. So you can try and use the brain because the eye is lost, not the part of the brain which sees. And using electrodes or something. So this goes into neuroscience. Can be done. AI should concentrate on that.
So we'll head into the rapid fire round where I'll ask you questions and ask you questions which are short. So what is one myth about eye care that people should stop believing in?
Lasers do work.
Okay. So
Provided the right laser for the right problem is applied.
one advice that you would give to students who want to pursue ophthalmology.
It's a tough grind. Be prepared.
And one habit that you never compromise on before a surgery.
I pray.
You pray. What are some of the possibly worst things that I can do to my eye in this year of 2026? This is not for advice.
Abusive screen time.
Talking about screen time, has it become an inevitable part of our current day-to-day life at this point?
It's an addiction like cocaine.
Okay.
So you have to either go to a de-addiction center or find other means to sort of de-addict yourself. There are other ways to get high.
One book that one must read or a movie that one must watch before, pursuing the idea of becoming a doctor.
Forrest Gump. Life is a box of chocolates.
So what must students look out for? I mean, we do know it's a tough grind, like you said, but what must one look out for while pursuing this career of becoming a doctor?
You need to study hard, and your parents need to have a lot of money or and no, it's like I don't want to generalize doctor as such. I would be a person who will say, try to do what you love most. Because not only will you be doing something which makes you happy, but you'll be earning money by doing it also. So it could be medicine, engineering, arts, business, whatever. Whatever the thing, my thing, just like how I told my son, do what you love to do most and go with it. Don't worry about the money. There will always be money around. Nobody's going to be poor. Nobody's going to die hungry. So do what you love to do most. And it should be relevant to the society, of course. Love to do most shouldn't be something destructive to the society. It should be something you know.
Right.
And
Beneficial.
It need not be beneficial to the society, but it should be something like, see, art. You might love to paint. You might be a good photographer. You like to take nice pictures. You're into all this. You might one day want to make small documentaries. So go with it. But don't look for that this is going to make me rich. This is going to make me this. Go with the flow. Everything else will follow.
That's the process.
That's destiny.
So in the current year, I mean, after all the news about the NEET, I mean, I'm pretty sure all the students are burnt out. So do you think it's still worth it becoming a doctor with, how their lives are going to be over the next years?
A doctor's life depends on the doctor himself, how much he wants to bite and chew off. If you can strike a work-life balance, which most doctors don't, then it's a bad choice. Whereas if you are someone who has a good work-life balance, I'm talking about Indian doctors. Abroad, they have an excellent work-life balance. They will work only X number of hours and after that you can't catch them. Here, people are working 24/7, 2 a.m. I know friends who work till 2 a.m. in their hospitals. So yeah, if you can strike a good work-life balance, medicine is beautiful.
So you spent your life trying to help out people, clearing out their vision, making them see. What is, being an eye surgeon taught you?
See everything in life. So we are there to, if you're not seeing clearly, we are here to make you see it clearly. What the Babaji does in the temple, we are doing in the theater.
I think we should be grateful that we are able to we're able to find ways to cure the eye, because that's one major part.
No, medicine is still, there are so many things in medicine which we have absolutely no clue about. And by the way, cataract is not a disease. So it is something which has grown old and we're just replacing it. So it doesn't fall into the disease category. We just replace like a old hip or old knee, So like that, cataract is something which occurs usually with age. It can occur even in newborns. That's a different story altogether. But we are removing the cataract and replacing it with the best possible intraocular lens, which can give the patient phenomenal vision.
And would it? I don't think would cataracts still occur after replacing the lens?
Impossible. We have removed
Impossible. The whole.
we have removed the whole thing, which is cataractus.
Hmm.
No question of resurgery or anything. Sometimes your hip and all, there will be a time where you might has to replace the knee or a hip. No, there's no question of replacement.
And that would be it, sir. Thank you for being a part of this conversation.
Oh, it was nice.